Hi everyone, I'm Abdulaziz Muthana and she's Mrs. Najat Saeed Muthana. She's my aunt. She's almost 61 to 62 years old. We came from Yemen for treatment in India as she was suffering for Parkinson's disease, heaviness and stiffness of the left side of her body. For her, it was a very difficult to face everyday life and daily routine. She could not get up from her bed or stand on the chairs. It was really not happy. We were suggested by one of our good friends to come to India and suggested and advice for care hospital in Hyderabad. She was that time like not even standing from the chairs or get up from her bed. Directly we came to India and Hyderabad. We came to care hospital and met the consultation with the Dr. Ameer Basha, Neuro Surgeon. He also advised for DBS surgery, that which has gone through and done in care hospital, high-tech city, with neurosurgeon Dr. Ameer Basha and Dr. Lalita and other team doctors of neurosurgeon department. She stayed in the hospital. We met a very nice stay in the hospital and a very nice service that we are satisfied and very happy. The nursing department and the surgery was gone through very well, which that we can notice the differences between how she was and her situation right now. Right now, her situation is very nice and very good. She's happy, she's satisfied, and she appreciates the hard work of the doctors and the team doctors. Now she's fit to fly to our country with happy. I mean, like there is no other problems. She's very thankful for the doctors and the teams and the nursings in the care hospital. Like we thank everyone in the hospital who has coordinate and help us to meet such very nice service. I would like also to thank Mr. Rajesh for his coordination and helping since we came to the hospital, and since we stepped the first step in the hospital, he was there doing us and guide us for all the procedure. I also thanks my friend who suggested me for this hospital and get such experience, which we are very happy and satisfied very well. So I would like to thank once again the Dr. Ameer Basha and Dr. Lalita and the other doctors of the team of neurosurgeon team.
I am Dr. Syed Ameer Basha, the consultant neurosurgeon with Care Group of Hospitals since last 25 years. I deal with functional neurosurgery in the Care Group of Hospitals. I have special interest in deep brain stimulation surgery for various movement disorders. Today I would like to talk about a patient who has come from Yemen. She is Saeed Najat. She is around 62 years old and she was suffering with Parkinson's disease almost since last 15 to 20 years. And she was kept on medication, and she had to increase her dosage of the medication for a long time, and she started having the side effects of the medications, the associated abnormal movements in the limbs, which was causing a lot of inconvenience to her. Then we suggested her deep brain stimulation surgery, and this deep brain stimulation surgery is a very simple surgery but very time consuming, and almost like it takes one full day to complete the procedure, even though it is a simple surgery, because this has to be done with the awake patient to exactly locate the site of the stimulation and the contact of the stimulator, where to be placed and how to titrate the dosage of the stimulation and all. So we operated on this patient a few days back, and we could place the electrodes in the correct subthalamic nucleus on either side, and we started programming after about a week. Now she is doing well, and she is completely relieved of the symptoms with minimal programming. And the beauty of this surgery is, like, a patient with Parkinson's disease who has to suffer lifelong with increasing dosages of medication and likely to have a lot of side effects of the medication. This is a boon for this group of patients, where deep brain stimulation surgery, which is like a navigated, like a GPRS system we use for traveling. We use the navigation system to place the electrodes in the brain, and we choose the targets very precisely, and we choose the contact of the lead which is to be stimulated, and the dosage of the current which is required to get the best therapeutic effect in the patient on the table. That is the beauty of this surgery. And this ensures that a patient is taken care and then delivered the proper dosages, and then in the follow-up, according to the requirement of the patient, we can do the reprogramming and adjust all these dosages of the stimulation and pulsations of the stimulation to help the patient. Thank you so much.